Right. Yes?
Hello, I'm Dr. Yassine, one of the doctors in the medicine clinic for today. May I confirm that you're Mrs. Mona and you're 40 years old?
Yes, doctor.
Mrs. Mona, today we are here to discuss about your health condition and I'll be happy to examine you and address your concern. Is it okay for you?
Yes, please.
It came to my knowledge that you have some tummy swelling. Can you tell me more about it?
Yes, doctor. I have tummy swelling concerning me so much, and this started suddenly 1 week ago.
I'm very sorry to hear this, Mrs. Mona. It must be concerning for you. Is
Yes.
it the first time to have such a tummy swelling?
Yes.
Never had it before.
Never.
And how did it start? Started all of a sudden or started gradually?
Yes, 1 week ago, I started to feel that my tummy is getting larger and larger, and there is heaviness there.
Very sorry for this, and it's increasing by time.
Yes.
Did you notice something increase it?
No,
Did you notice something make it better?
nothing.
And is anywhere else you have swelling, like your legs or your hand, your
Y-
face?
Yes, my legs are also swollen.
Swollen.
Yeah.
Okay. With the stomach swelling, do you feel pain also?
Yes, I have tummy pain.
Which area of your body?
It is all over, doctor, but mostly in my right side.
Right side. Okay. And this pain since 1 week also?
All started 1 week.
Mm. If I will tell you 1 to 10, how much you can give pain score?
It's about 5.
5. Okay. And is it increasing?
I think it's the
Anybody?
same. The same.
Anything make it more?
No, no,
Anything make it better?
nothing.
Okay, is it going somewhere else?
No.
And how it seems to be like this pain,
More of dull aching, doctor.
dull aching. And you feel sick with this?
Yes.
Throwing up?
No throwing up, but I feel sick and fatigued for the last 1 week.
I'm very sorry to hear this. Do you have any alteration of your bowel habit?
My bowel is okay.
Any water work changes?
My water work is okay.
Okay, do you look pale?
Yes, they commented that I look pale.
Any yellowish discoloration of your eyeball?
No, no,
Any difficulty of swallowing?
no,
Any mouth sores?
no,
Any acid brush
no,
sensation in your
no,
chest?
no, no.
Okay, and with your leg swelling, this is also 1 week back.
Yes.
If you press over it, it leaves mark.
No.
And does it pain also? Give you pain?
You mean about my legs?
Yes.
Yes, my legs, yes. There is some socks marks over it.
Okay, and is something increase it? Standing, for example?
Yes, yes. Standing make it more.
Something make it better?
Maybe
Lying
like
down?
maybe lying down slightly improve.
Okay, right. Do you have any awareness of heartbeat with this?
No, but I have awareness of my heartbeat all the time before that.
Awareness of what?
Of my heartbeat, I feel like my heart is slightly
Before
racing.
that, you have awareness of heartbeat.
Yes,
Yeah.
yes. So especially with effort, I feel my heartbeat is racing.
Very sorry to hear this. Any chest pain?
No chest pain,
Any breathing discomfort?
no breathing discomfort.
Any cough?
I have coughed before, doctor. This is for multiple times.
And what it seems to be is a wet cough or dry cough?
Yes, I have recurrent attacks of wet cough.
Okay, like how many times? Like since how long?
For years now, doctor, I have recurrent attacks of chest infection, which I admitted to hospital and diagnosed with pneumonia and improved with antibiotic.
Okay, okay, and regarding your awareness of heartbeat, this is since how long?
This is for a long time now, doctor.
Is it with like going fast or going slow?
I can feel it with effort more, going fast.
Did you ever collapse?
No, no,
I'm sorry to ask you, do you have any high body temperature?
no,
Weight change?
no,
Lumps and bumps?
no,
Any weather preferences?
no.
Any dizziness on standing position?
Yes.
This is since how long?
For a long time, doctor, now.
Okay, did you, and you never collapse? Okay.
No, no,
Any headache?
no headache,
Any vision problem?
no vision problem.
Any joint pain?
No,
Any back pain?
no.
Any skin changes?
Yes, I have some skin bruises all over my skin.
This is since how long?
This happened for also long time, doctor.
Okay, are you taking any medication, Mrs. Mona?
Yes, I'm taking oral contraceptives
This is since how long?
for a long time now, maybe 2 years.
Okay. I need you to stop it, Mrs. Mona, since it can be related to your current condition till we sort it out. Is it okay?
Yes.
Did you ever diagnose with any health condition?
Rather than the recurrent chest infection, no,
Okay, and apart from oral contraceptive, do you take any other medication?
no,
Any illicit drugs?
no,
Any family history of liver disease?
no,
Family history of any problem, clots?
no.
Okay, is your cycle, I'm sorry, is regular?
Yes,
Any miscarriages?
no,
Any chance that you're pregnant?
no.
Okay, do you have a partner?
Yes, I'm married.
No, any casual relationship.
No, no.
Okay, may I ask you also what do you do for living?
I'm a housewife.
How is the things affecting your job and daily activity?
For
Your
long
daily
time,
activity.
for a long time, I have been fatigued, and many commented that I look pale. But for the last
Mm,
1 week, the fatigue increased with this tummy pain and tummy distension.
I'm very sorry for this. Very sorry to hear this. Do you smoke?
Never,
You drink alcohol?
never.
Okay. Did you travel recently?
No.
Can I examine you?
Yes, please.
I need full vital signs of the patient.
Okay. Vitals is okay.
I need to examine the patient. Does she look pale?
Yes.
Does she look jaundiced?
No.
Okay.
Okay. This is the tummy of this patient.
Okay. I need to examine the patient for abdomen.
Yes.
Is the patient there is dilated veins and there is
Hmm.
is there is any okay, I'm sorry. Is there is any palpable organomegaly?
Yes. There is hepatomegaly could be appreciated about 5 to 6 centimeter below costal margin.
Okay, is it tender?
Yes, it is tender.
A consistency is smooth or
Firm.
firm?
Firm.
Okay. Is there is any palpable spleen?
No.
Any ascites?
There is positive shifting duns.
Okay, may I examine patient is there is any sacral edema?
Yes. There is sacral edema.
And I need to examine the back of the chest for any crepitation in the lung.
There is basal lung crepitation.
Okay, right. I need to examine the patient cardiovascular. Is the pulse is regular?
The pulse is regular. Yes. Continue.
Is there is any lung base
Yes, there is basal lung crepitation.
crepitation?
Yes.
Any abnormal sounds?
No, no.
Is the pulse is regular?
The pulse is regular. Yes.
Is the apex in place?
Yes.
Okay, right. And there is any murmur can be appreciated?
No.
Does the patient has any spider nevi?
No.
Any loss of axillary hair?
No.
Okay. Is lower limb, is it edema?
There is edema. Yes.
Okay. Can I ask you, did you go for any surgery or procedure, Mrs. Mona?
No.
Any blood transfusion?
No,
Sorry to ask, any sharing needles or tattooing?
no.
Hmm. Okay, right. Mrs. Mona, may I ask you, what's your concern?
Yes, please. My concern about this stomach swelling, what could be the cause?
Hmm. Your concern is very valid, Mrs. Mona. I think after I spoke to you and evaluating you that you have a condition which we call in medicine Budd-Chiari syndrome. It's a term, medical term, when there is in some clot formation in some of the vessels of your liver. And unfortunately, this give you this distension because there is some fluid collection in your tummy. It gives also pain. And I'm afraid to tell you this can be related to the pregnancy, the contraceptive pills which you're taking. So I would like you to stop it till we sort it out and see what's next.
Okay,
And we need also to search to dig for the other causes, like maybe your body is making clot formation, liable to give clot formation than normal.
okay,
So what we need to admit you in hospital, and we'll make a team from the liver doctor, woman doctor, as well as chest doctor and heart doctor, and we will try to sort it out for you.
okay,
And I'm afraid to say that you have also some fluid collection in your lung. Could be related to the current liver condition. Could be related to heart condition also. We need to find it out.
okay.
Do you have any other concern?
Yes, doctor. Could this condition associated with my recurrent chest infection?
Your concern is very valid. There is, yes, there is disease which can give recurrent chest infection as well as liver problem. We call it alpha 1 antitrypsin deficiency,
Okay,
which can give this recurrent infection as well as liver problem. So we need to roll it out.
okay, okay. Thank you, doctor. Now,
Thank you.
yes, now discussion with the examiner. Present your positive
Mm.
finding, please.
Mrs. Mona, 40 years old, presented with tummy swelling as well as tummy pain. On background of having recurrent chest infection and palpitation, as well as she's taking OCP.
Okay,
On examination, she is vitally stable, and she's having hepatomegaly as well as the ascites, shifting dullness, most likely it's ascites, and lung basal crepitation as well as lower limb edema.
okay,
So Mrs. Mona, she's having congestive liver disease with
okay,
ascites, with fluid overload.
okay. What's your differential diagnosis?
The in term of sudden onset of swelling and tummy pain, it can be Budd-Chiari syndrome.
Okay,
The other diagnosis can be something related to a cardiac issue,
okay,
with which give her congested liver as well as ascites. Needs to
okay,
rule it out,
okay,
and we need to rule out other liver disease,
okay.
um,
Like
mhm,
what?
like malignancy,
Okay,
like hepatitis.
okay, okay.
Um,
So you mentioned
mhm.
about the possibility of Budd-Chiari syndrome. What could be the cause under this Budd-Chiari syndrome?
Being a female on oral contraceptive pills, this is one of the risk factors.
Okay,
However, she doesn't have any history suggestive of hypercoagulable state
okay,
in terms of recurrent miscarriage or any autoimmune disease. But
okay,
still, we need to rule it out.
okay. Any other possibilities could relate the development of Budd-Chiari syndrome and at the same time the history of recurrent hospital admission for chest infection? Any other causes of
Um,
hypercoagulable state could result in both symptoms?
um, I'm not sure.
You are not sure? Okay. Could be BNH?
Could be, but patient denied any water work changes actually in
O-
her
Okay.
history.
Okay. What water work change you expect to find in this patient and at which time of the day?
Actually, Mainly, it's early morning and after the urine left for some time.
Okay. So patient may not notice such water work change,
Mm.
but you may ask by name. Okay. Any other possibilities you need to ask to exclude in the history taking?
We need to rule out autoimmune disease like
Yes.
SLE.
Very good. What else?
Uh, we need to rule out also Behçet disease.
Very good. Did you ask for oral
Uh,
ulcers or genital ulcers?
mm, no, I
O-
miss this.
Okay.
Mm.
Okay. What other? What other?
We need also to rule out family history. We ask for factor 5 and for the protein S and C.
Very
And
good. What other? Maybe the patient
uh,
is telling you that she has symptoms of pallor and collapse, not collapse, but postural hypotension and racing of the heartbeat, which may denote anemia. Could anemia and
mm,
Budd-Chiari syndrome be related?
yes, if there is paroxysmal nocturnal hemoglobinuria, patient will have anemia as
Yes.
well as she will get risk of hypercoagulable state.
Very good. What other causes can combine Budd-Chiari syndrome with anemia?
Any autoimmune disease like
Very good.
SLE,
Very good. What else?
um,
There is some blood disorder which can result in both pictures. Could sickle cell anemia do this?
yeah, could sickle cell anemia, yeah.
Yes, very good.
But,
Very, very good, very
mhm.
good. Okay, so if this patient is paroxysmal nocturnal hemoglobinuria, how would you like to investigate?
I would like to do a hemolytic picture. I would like to do a full blood count and reticulocyte count, and I would like to do flow cytometry. I would like also to do to see haptoglobin. I need to do also um,
Okay. What, do you want to do anything else in the lab?
urine test
Urine test searching for what?
for urine for my hemoglobinuria.
Very good. Okay. Anything else related to the blood,
Uh,
maybe?
um, we need also to rule out other hypercoagulable state.
Yes. What?
We need to do LADH,
Okay.
bilirubin, comb
Okay.
test.
Okay.
We need also to, we might need to do also bone marrow
Okay.
aspirate.
Okay. Okay. Do you want to assess the liver in any way?
In this patient, we need to do urgent ultrasound,
Yes.
Doppler.
Yes.
We need to do also alpha fetoprotein. We need to do liver function test.
Okay.
And we might need to take acetic tab for serum albumin, acetic fluid albumin
Very good.
ratio.
Very good. What do you expect?
In this patient with the hypercoagulable state, I think um, it will be less than uh, 11.
Less or
It will
more?
be
Less or more?
it will be exudate.
Less or more? You expect portal hypertension here?
Yes, I expect portal hypertension.
Okay. So if it is portal hypertension, you expect the SAG to be more or less?
The serum albumin to the acetic fluid albumin ratio
Hmm?
will be less than 11.
No, it will be more. It will be more than 11 or more than 1.1 milligram per deciliter. Okay, if it is related to
Mm.
portal hypertension. Okay, how would you like to expect the albumin here in this patient? Will the albumin will be normal or decreased?
Reduced.
Reduced in acute state?
Mm.
No, the
Uh, uh,
albumin here will be normal because this is acute but Chiari. But the chronic
mm.
situation, like the chronic portal hypertension, the latest stages of Budd Chiari and the cirrhotic liver, you expect this patient to be less than. You mentioned about something cardiac. How would you like to investigate the cardiac causes of this acute tummy swelling? What cardiac causes you
Uh,
expect?
if there is any acute heart failure,
Very good. Congestive heart failure. So you need to do
mm.
what?
I need to do urgent echo and PNP
Okay.
and
Anything else like, yes, anything else rather than acute heart failure?
you mean in the heart?
Yes. Will cause the
Um,
same symptom,
if there is any pulmonary hypertension,
pulmonary hypertension? No. Anything else?
mhm. If there is any, I'm not sure.
Maybe constrictive pericarditis may result in the
Mm-hmm.
same picture. Maybe inferior vena cava obstruction. Yes.
Mm-hmm.
Okay. Very good. Very good. Thank you,
Mm-hmm.
doctor.